I would say roughly about 2 years ago. I had prostate cancer. It was 3 and a 4, which added up to the tally of 7, which was a treatable, or the low dosage of prostate cancer. My oncology doctor, when he discovered that my prostate was rough and he'd have to do biopsies, and then it was discovered that I had cancer, prostate cancer, he then invited all my family in to the discussion. Personally, I wanted it taken out, and he discussed that with us. Luckily, we had a friend that was in radiology, and she suggested radiation. I discussed that with my oncologist doctor. He done a program on it being taken out, plus the program on having it radiated. It came out very well the same, so we selected to have a radiation. Was referred over here to the Marta to see Dr. Tang. He discussed it with me and my family, and then we proceeded from there. I welcomed it, because I felt it would do something for myself and for other people, to benefit other people. So that's the reason I went on, and was grateful that I was able to go on a clinical trial. Seeing it was the short trial of 20 days, or 20 days, 5 days a week, compared to the larger trial. So, and I was quite happy with that one. Just the benefits were that I'd be had all the examinations, the scans done here. Was able to have the gold seeds inserted, ready for anything, and being able to be checked every 6 months with the trial doctors, and which I've been on it now for 2 years, and every 6 months I've got to come and see the doctors at the hospital, and then I've been told it will last up to 10 years, so that's how I feel it will benefit everybody by doing that. My doctor got 3 gold seeds, I think, from the trial, from the Marta Hospital, and he inserted the 3, which then when you people ultrasound me, they can exactly pinpoint where the prostate is. So every time I go do it, and plus my examinations, they tattoo you, ready for the procedures. So then they are able to then line you up exactly where they want to put the radiation treatment into. I just accepted it for myself and for other people. My wife was able to come into the bunker. The staff took my wife in to show her the procedures, but asked her to leave while I was in there by myself. Yes, you get treated very nicely down there, and the whole process from down there is when you first have your first appointment ready for radiation, it is all programmed out every day that you've got to come, what time, what bunker. So everything is totally organised for your benefit and other people's benefit. doesn't worry us. Got the program from one time to the next 6 months, so you know what you're doing. No. Plus you get better results too with being back seeing the doctors. You know how you're progressing with your PSA. So it's to do with your level of prostate in your prostate gland. I can't remember exactly what it stands for, sorry. But that's what we're treated with in our blood to see how levels are going up. That's when they start doing research on us males to see if we have problems. Mine wasn't a great height, but my oncologist doctor felt that there was something every time he examined me. So that's why he done biopsies. That's why we ended up on the trial. I was quite pleased because always in the back of your mind, pardon me, that you could have something. When I was diagnosed, well, I was able to accept it and then go along with life to try and benefit myself and other people. My family were a little bit upset, pardon me, but as myself personally, I was able to accept it and get the benefit out of it, which I have so far. No, my family all accepted it and thought there was benefits throughout the whole of the family. You're not a guinea pig. So, they accepted it and we were thankful for it. One of my daughters could see that there was benefit in it, that you're getting monitored all the time and can get the benefit out of being monitored all the time for yourself and for other people. Oh yes, it was all, pardon me, it was all wrote up in the paperwork that you could stay with the trial or withdraw from the trial. If you wanted to withdraw, you was asked to speak to the staff in case there was things that needed to be explained to you. No, I think everything was very well regimented. Wasn't forced on you. It was recommended, and to me, be thankful to be able to do it. The other trials was still the same. On the longer period, they were well supported too. So there was no nitpicking between the shorter trial or the longer trial. I would highly recommend it. There's a lot of benefits that I feel you get out of being on a clinical trial. A lot of hard work done by a lot of other people to benefit you and other people. That's how I personally feel. Well, I believe with the shorter trial, it's less time that you've got to keep coming back to the hospital for radiation, compared, like 20 days compared to, I think it was nearly 40 days. And I just feel that's a lot of benefit to a lot of people. And as for me personally, the radiation has not affected my bowels or my bladder, even though I am up and down 2 or 3 times a night in the winter. It's been the same for years and years. The only thing I've probably had was a little bit of funny feeling after I passed water during the trials, but I put that down to not to any problem. So I still have no problems with my bowels or my bladder. Yes, you turn up at radio oncology, they take you to the bunker. You're always met with one of the team members come out of the waiting room and pick you up. Normally my wife and I were there, take you down to the bunker. You're taken into the bunker, and when you're there with young ladies and you're told to drop your gear, so you've got to drop down to your underwear. Then they put you onto the table, they line you up, they explain everything that they would like you to know, what you need to know. Then when you're all lined up, they then, pardon me, they'll tell you that they're leaving, the door's shut, and then you might feel your bed, the table, or shake, and they're from the office, they're lining you up a little bit better if they need be, and then your treatment starts. And you're there for probably 10 or 15 minutes, and then it's finished, they come in, you redress, then you leave, waiting for the next day. It happened for 5 days, Monday to Friday, and you get the weekend off. Then you start back Monday. Yes, there was no fear, just the way the staff looked after you, relaxed you, and made you feel at home.